Hello, and welcome to the second episode of Unfreezing the Truth of Frozen Shoulder, also known as Adhesive Capsulitis, where we dive even deeper into frozen shoulder. Rejoining us, we have Dr. Philip Peng. Glad to have you back, Dr. Peng.
Glad to be back.
So, in the first episode, we talked about frozen shoulder, what it is, the symptoms, presentations, and such, and you really emphasized physical therapy. Can you tell us more?
I'm going to bring someone with expertise in this area. Her name is Chanel from Halifax, and she has interest in this area.
Hi, Chanel.
Hi, Chanel.
Hi, Dr. Peng. Hi, Alina. Thank you for having me today. And hello, everybody. My name is Dr. Chanel. I'm a board-certified chiropractor and one of the rehab providers here at Fluid Health. It is an absolute pleasure being with you all today and answering these questions.
I have a couple of questions for you. One of the questions is, do you treat the patient differently when they are at different stages of the frozen shoulder? Say when they have a lot of pain initially, worse the time when they have much more stiffness at the later stage. Will you give them a different treatment prescription based on the stages?
That is a very important question and one I get commonly asked. No matter what stage of adhesive capsulitis or how much pain the patient may be in, there's a common theme that holds true, and it's movement. We have to get the shoulder moving. The only thing that changes between patients is the sets, the frequency, and the resistance. Barring any complications, the exercises stay the same. And this is just a fancy way of saying that as the patient moves through the rehab plan, we increase the amount of times they exercise and we increase the weight because we want to reintroduce the mobility, we want to push past the boundaries, and we want to restore normal functionality. A lot of patients will ask, if it's painful, am I going to make it worse? As Dr. Peng, you have covered in a previous episode, we know inflammation of the capsule produces and generates that pain. However, recent evidence shows that immobilizing the shoulder will actually make it worse because the capsule will tighten, it will get stiffer, and it will become even harder and more difficult to initiate movement with a patient because it is more painful. So the earlier we can introduce movement, the better we will see results with the patients. I like to divide rehab into two separate categories. One is manual therapy, things that I do here in the office, whether it includes soft tissue therapy, mobilizations, range of motion, to reintroduce you moving that shoulder again. And then there's the exercise portion, things that I'll introduce here and that you can do at home. That is truly crucial for any rehabilitation plan. I like to kind of use a metaphor to explain it a little bit better. Think of a rusty car sitting in a garage. What's going to be the best thing for it? It's getting out and driving it so it doesn't rust over, correct? Okay. So I can start the engine, drive the car out of the garage, but you're going to be the one to have to drive it around the lot to keep it going. Exercise is crucial, and I'd like to establish that with my patients so they always understand that they're in control of the rehabilitation. The shoulder needs pattern, the shoulder needs mobility, and it's okay to feel a little bit of pain. Just always communicate with your rehab provider and stay on track.
Okay, we understand. Actually, there's so many challenges with physiotherapy. For example, access to care. Sometimes patients don't have the money nor the time, barrier in transportation, as well as compliance. Sometimes patients don't even want to go to physiotherapy.
That's exactly I would like to go back to Chanel for this episode because I would like to Chanel to show us some of the exercise that the patient can do at home.
Thank you, Dr. Peng. You and Alina have made an excellent point. Rehab providers are not always accessible for patients. So whether it's a chiropractor, physiotherapist, or kinesiologist that you can't go see, the good news is that exercising at home is free. And remember what I said, any movement is good movement. So stay tuned and I will show you 6 exercises you can safely do at home. So the first exercise is called the Pendulum Exercise. You're going to first find a stable and flat surface that won't move under your body weight. Lean over, hinge at the hips, and let your shoulder fall so gravity takes it. So gravity is suspending it. Next, you're going to slowly spin it in circular motions. You're going to do this for about 30 seconds. And then after 30 seconds, you're going to reverse the motion. The second exercise I'm going to show you is called a wall stretch. So again, you're going to find a sturdy surface, one that you can't push, but you can lean against. but you're not going to suspend your body weight against it. You're going to face the wall with legs shoulder width apart, and either with one arm, you're going to crawl up as much as you can, hold for a couple of seconds, and then crawl all the way back. Or you can do with both arms, crawl all the way to the top as much as you can, pause, and then crawl all the way back. The third exercise I'm going to show you is called the towel stretch, but you could actually also do this with a broomstick as well. Just unscrew the top of the head, whatever is easier or more accessible for you. I'm going to face the wall but explain what I'm doing. So again, legs are going to be shoulder width apart. You're going to put the stick behind you. With the unaffected arm, you're going to reach behind you. And with the affected arm, you're going to grab the bottom. You are going to slowly bring up the towel or the dowel as much as you can. You're going to hold to the point of tolerance and then slowly bring it back down. The fourth exercise I would like to show you is called a table slide. So you're going to get a comfortable stool, chair, or you can kneel. Get a tabletop beside you and just set up like this. You're going to slowly reach forward and allow your body to bend forward as well to as much as you can. As soon as you reach a point of tolerance, you're going to hold for a couple seconds and then slowly raise yourself back up to neutral. That's one way you can do it. The second is putting your arm to the side and then do the same. You're going to slowly reach over, bend, and reach out your arm as far as you can, and then bring it back to neutral. The fifth exercise I'd like to show you is just a cross-body stretch. Again, you're going to be seated, feet planted, shoulder width apart. You're going to slowly bring the affected arm to the opposite side of the body. Now, this may be difficult for some people to do, but you just do the point of tolerance. So if this is where you're able to reach, you're going to take the unaffected hand and just push towards your body. And hold for a couple of seconds, and then bring back to neutral. The last exercise I'd like to show you is something called a broomstick assisted external rotation. Having your feet planted shoulder width apart and placing the stick with palms facing upward, you're going to take the affected shoulder and elbow and tuck it into your side. With the unaffected shoulder and arm, you're going to hold the broomstick and gently push to the opposite side. Hold for a couple seconds and then bring back to neutral. And then repeat.
Thank you very much, Chanel. Just for the audience, I would like to let you know what we just talked about in this episode is mainly a general advice what you can do at home for rehab. Each individual patient may have their own underlying condition and specific requirement for rehab. So we still advise you to consult your physicians about the treatment plan for your adhesive capsulitis or frozen shoulder. That concludes our second episode. And we will have the third episode, which is about the intervention for the adhesive capsulitis. Stay tuned.